Thank you very much for the invitation. And I understand, it's a little bit difficult to say my surname, so don't worry, Agatha is enough, So I would like to thank you for organizing committee to put this important conference together, speaking about the health innovation and what does it mean. So being in the pharmaceutical company, I'm going to focus a little bit more on the medical part, on the medicine part of innovation. So speaking about the innovation, we went back and looked at what is down the road coming in terms of a new medicines. So as we see it, there is around 7,000 medicines in development, and which will be, the new challenge coming. So when we look at which areas are there, they're basically in the 4 areas. It's about a quarter of them, it's in the cancer area, so treating, neoplasms and so on. The other 3 of them are immunological disorders, infection diseases. We know the burden on infection diseases. So one of things, I think it's also here in Greece, antimicrobial resistance and so on. And neurological disorders. We know that Alzheimer's disease is going to be, whoever finds the formula on Alzheimer's disease, it's going to be a really new big innovation. So there is a lot of innovation coming down the road. So going forward, what does it health innovation really, how the benefit of the patients and the society is benefiting through to health innovation? So I think we all agree that every patient would want to live longer and happier and healthier life. So, but then is a question, what is in economy? Does it bring something in an economy? And certainly the healthy population brings more job, more economy, better improvement of productivity, and so on. Now, the question is on the health system, because usually that means the cost, In reality, when we put the innovation there into health system, it's also helping to have more sustainable path in reducing the cost down the road, meaning if we treat, the diseases prior really getting to the complications, we might avoid, some cost of hospitalizations. And certainly in society, we know it that in the society we benefit and society is thriving, having a healthy population around them. So let's look a little bit more into the specifics. Looking back, cancer mortality rates. So over a period of time, saying cancer, it means really bad. It still means bad, But if we look at for the 20 years data, it means that mortality rates have been reduced by 20%. So it means a step forward. More than that, 2 out of 3 people, they're living more than 5 years. And I'm going to come back to the cancer and the treatment for the cancer and so on. And I think my predecessor have also talked, a lot about the oncology treatment. And so now cancer, we discussed it about cancer and what does it mean, It means the longer survival, the perspective, the future of many people. But we have more cases in this area. Speaking about, for instance, vaccines, influenza vaccines. Currently, we are in Europe, the number of influenza cases have been eliminated, basically eliminated. They are still, but we eliminated 2 million influenza cases. But moreover than this one, what does it really mean? So 2 million of influenza not happening is translated to reducing of cost between 10 to 15 times. So avoiding 2 million influenza cases brings 250 to 300 million cost saved. So I think the vaccines are one of the best prevention in the system. I have another example there. Cardiovascular diseases. Looking for the 10 years data, I think it's 10 years data on the cardiovascular diseases. Innovation in cardiovascular diseases, yes, it brings some more costs, as you see it in the slide. But the effect afterwards, the benefit of not costing of hospitalization has been much, much, much bigger than really the cost of the medicine. So, and I think we can go on and on in this discussion. Imagine hepatitis. So hepatitis become a chronic diseases. Imagine, not chronic, basically treatable diseases. But HIV is becoming a chronic disease. Being 20 years back, that was not the future. But with the innovation, with the new medicines and so on, we have helped many, many diseases. I'll ask you to think for a second, and how many of you know the cancer patient who has turned back to work? I think if we think a little bit, we all know someone, that is a cancer survivor and returned back to work. So if I go back, I'm a pharmacist in my early school age, so I had 2 of my student girlfriends, who has survived breast cancer. Guess what? 5 years after that, they are all, even earlier, but today they are happy mothers for the families, and they continue to work. So they contribute to the economy, they contribute to the productivity. So I think, going further down the road, and as you see it in the presentation, so basically 80% of people being a cancer survivors going back to work and contribute to society, contribute to economy, contribute to the productivity. The study that was done in Greece from Professor Lichtenberg, the study that has taken innovation treatments for the 15 years period of time from 1995 to 2010. And what it has been found and shows, it is that in that period of time, the average life expectancies have been prolonged by 2 years. Now, what does it have to have that with the medicine? Half of that, approximately half of that, has been contributed to innovative medicine. So meaning, in 15 years, the life expectancy is prolonged for 2 years, nearly 1 year is contributed to the innovative medicine. Moreover, 60% of those innovations have been offset by reducing the cost in the tertiary care or the hospitalizations. So I think there is a clear benefit in that. Yes, it's contributing to the longer life, but it's contributing to the productivity, it's contributing also to the reducing the cost of the complication later on. And of course, so that resulted in the more than 2% reduction in the discharge into hospitals. Okay. So speaking about all that, where are we going? What's currently the problem? What are the healthcare system challenges? But not only in Greece, it's around the world. And I think one of the challenges that currently the world is really facing, it's aging population. So today, it's about 20%, and I've checked the data today, it's about 20% of people over 65 years old. We know the comorbidities and major diseases is happening at over 65. It's around 20%. There are predictions that today, from about 1 billion population in the world being over 60, in the year 2030, it's going to double. Now, 2030 is not that far away. It's 12 years. It's not that far away. So aging population is a big problem there. Certainly, with aging population, it comes more burden of diseases, more comorbidities, more of diseases, and so on. Now, having the aging population, having more of the diseases, having comorbidities that we need to deal with that become an increasing higher and significant pressure on the social, on the political agenda. And altogether, that the world is currently dealing is combining with what we have it today, that we need to understand that demographic changes and the changes come down the road, and have the good understanding of data, understanding what is happening, and how we deal it specifically in Greek with a constrained budget. And another example one example, speaking about the comorbidity and the problem of diseases, is that today 12% of total populations who have a lot of comorbidities and major diseases, it's contributing to 40% of all of the cost. So there is a burden that we'll need to do something about that. Now, excuse me. So now when we put all of that together, is saying, okay, so it's clear we have innovation on one part, we have innovation solution on one part. On the other hand, it is saying, okay, where are the access for the innovation? How can we bring those innovation closer to the patients? And to put the triangle together, I think the cost is playing a significant role. So looking all together, yeah, it's innovation, it's access, it's and the cost, So what we work it together, there are some of the ideas that I will share it today with you. So how can we tackle and also comparison, from some other countries? So the step number one, I think, when we discuss it about aging population, about a lot of diseases and so on, that is not only the agenda of a Ministry of Health. I think I could not, probably all of you could not also agree more that with Professor Marmot saying that all ministers are health ministers. Why? We all have a role in there. We discuss it about aging population, but it's also a big public health problem. Is how do we manage all disease management strategies, because it's not one disease and the aging population is more of diseases. Is where it goes into public health agenda, it's what do we do in terms of a healthy lifestyle? How do we educate the kids in the schools? So the agenda of the health agenda is not becoming only the pharmacist and the health minister, but it is across the board agenda of everyone, and we all feel responsible to work it on the all-inclusive public health problem. The second step, which might be a solution as well, and as I said, I'm sharing, some of the ideas, is increasing generic prescriptions. So we know that generics, they're a lower cost, so increasing generic prescription can leave some room to help and support an innovation. Now, when I look at there, I said, okay, Belgium is a country which is similar like Greece. But what Belgium has done over the past year, they have capped budget as well. In Greece is a capped budget as well. So, but what the Belgium has done they, through to the better management, also with the generic prescription, they managed to create an innovation island that they kind of support it because they believe in innovation. They believe it what innovation is bringing to the society. So they find the room to support the innovation agenda, and because it's a first to believe it that innovation brings success. The last two, it's, of course, I think having a good, proper HTA mechanisms in the countries is also helping, to unveil and find, where is the room, to support it for the healthier and better population. So where do we talk about healthy HTA mechanisms? It's simply as two things, how does it work? Have it based on evidence-based medicine? Does the HTA work? So is it there an efficiency there? And what is worth it? What's the cost of it? Going, in looking into Europe, the mechanisms are already there. UNECTA core HTA model has been established. I think all the elements are already there. Many countries have gone through to it. I think that the system are there. It's just, the matter of implementation. And lastly, when we talk about, yes, there was the generic prescriptions. We talk about the public health agenda for everyone. We talk about HTA. The last one is also what I believe it, some capabilities, managerial capabilities. For instance, I think, in Greece is one of the best electronic prescription system, but can it be done the step forward? And we can have a prescribing monitoring capabilities as well there. Do we know, what patients is prescribed, at certain point in time? So it's a step forward and system is already there. Or speaking about establishing therapeutical protocols or disease registries. We have many examples from many countries, a lot in Scandinavia as well, having disease registry, a good source of data and seeing how we can well invest the money. The third one, is also implementing negotiation agreements. We have one of examples from last year, hepatitis C. I think there could be more to come, and that is also a room of creating an island of supporting innovation. The fourth element is when we have a constrained budget and we say, okay, we believe it, that some some solutions there, like vaccines, they can bring, the solution later down the road. So I speak about influenza before, and what is the saving of the cost down the road, and we know that vaccines are the best preventable solution. So why penalizing them? Other thing could be HIV products and so on and so forth. So excluding some of those elements, we can also help, finding innovation. And the last, not least, to implement disease management. And I think time is up. Okay, so I'm finishing. Excuse me. So all in all, just to conclude it, if we put patient in the center of everything we do, I think that the agenda will fit together and we will find the best solution, but we need to have patient in mind. So to the last slide, and this is the last slide, so to conclude it, is the question to me it is, are we putting the patient first and really finding a solution around the patients, or are we trying to manage everything else, and then maybe patient is not necessarily the first ways, but when we try to fix it, all other problems, it might cause it delayed access and certainly low on innovation. On the other hand, if we look at the other side of the slide, patient first, everything will be around the patient, around disease management, around the needs of the patient, which will find a way, for innovation, for access, and for the better and healthier and happier patient. So with this one, thank you very much, and sorry for being a few minutes late.